If you love Pilates, but you struggle with tummy pain, bloating, inflammation, perhaps due to endometriosis, adenomyosis, other gynae issues, or IBS that can cause it too, you might find that when it comes to your Pilates class, during those times of the month or those periods where you're a little bloated, it can feel uncomfortable and it can put you off actually wanting to do it. Now, I have adenomyosis, so I am no stranger to that kind of inflammation. I also have IBS, so again, I know how it feels, but I teach Pilates, so I can't skip my class if I've got tummy pain or if I'm bloated. So I've had to find ways to adapt Pilates to help during those times. Now, if you have inflammation here, the abdominal wall can actually be quite distended, and that would be the same actually if you were carrying fat around your middle as well. Excess adipose fat around your middle can also cause that kind of distension, that stretching. So there are some really easy ways that you can adapt Pilates to make it more comfortable. But also, if you use Pilates to help you unwind, I know it helps me with anxiety, it helps me with stress, and those things can make IBS worse. So I don't want to skip Pilates because I know that actually it's really good for me. So I'm going to just show you through 5 really simple things that you can do to help adapt Pilates so that you can do it safely and more comfortably during those times when you've got that swelling. So some favourite exercises take place here on the mat, but if you've got that swelling through the tummy, you might find that if you even just try and let your knees lift over to your hips here, because of that distension and swelling, it's harder to find the right position. You might find some of the work goes into your lower back, and if you're already sore around the tummy, you just don't want to do that. So one simple thing you can do is take a small cushion or a folded up towel and pop it underneath your hips. Now, I'd stress, don't make it a big one, right? It needs to be quite thin and flat. All this does, and you'll notice this immediately, it changes the angle of your pelvis ever so slightly so that you feel when you come into these positions, it's just a little bit more comfortable. So your pelvis isn't having to kind of fight to hold that more neutral position. You can let your knees come up, and if you just do that now and feel that little pull through the tummy, that means that you can do things like your single leg stretch. You might not want to do double leg stretch if your tummy's a bit sore. You could do your 100, but again, I would just suggest keep it at a slightly lower level while you've got those, while you're during those periods where your tummy's a bit more swollen. But that cushion under your bottom can make such a massive difference. Now, because that tummy can feel quite swollen, doing some of the exercises on our hands and knees tends to feel a little bit more comfortable, because if you're on your hands and knees, you've not got so much pressure on your back. In fact, you can let the inflammation just hang down a little bit. So from your hands and knees position, say let's you come into a hover position here, so your toes under, lift and hover, and then just gently feel you lift your tummy away from the waistband of your leggings up towards your back. It's just a little bit easier to manage if you've got that discomfort. And the same would be true actually, again, if you're someone who's got fat around the tummy, you're carrying abdominal fat that creates that distension, then you might find the hands and knees exercises are a little bit easier to achieve than those ones on your back. So it's really important to remember to keep doing your spine mobility exercises. They're just going to help kind of unknot everything so that you feel a little bit more comfortable around the middle. I love a side bend because you want to get the spine moving all 3 ways. So we've done forwards and backwards. We want to do a side bend on your forearm here. Make sure your elbow's right under your shoulder. You've got plenty of space between your ear and your shoulder. And then let this arm come up. Breathe in, come over to the side. And then let your ribs come right down to the floor. It's this gentle rocking. Just stay in a range of movement that feels comfortable for you, so don't push anything. Breathe in and feel that you are as if you were doing this against a wall, so you're not going forwards and backwards. You could add to this by coming up, all the way up onto your forearm. Take a breath in as you open up, and then slowly come down. Breathe in as you extend, exhale as you come down. So twists also feel really nice when you've got inflammation through the tummy, especially actually if it's IBS related, because that can just help to unknot around the digestive system. One thing I would say though, so we're going to do a twist just with the toes on the floor. You could let your knees come over to the side. You could actually support those knees as you come over to the side. So any kind of twisting movement where you're feeling your hips are going one way and the ribs are going the other. You could also do that with a knee lifted where you're coming across and in and out. And again, you might want to do that with that cushion under your bottom like I showed you before. One thing I would say with twists actually during a time when you've got that inflammation here is not to overload the twist. So we don't want to go both feet up, these big twists over to the side. Your lower back, your spine is quite vulnerable, so if it is just feeling a little bit uncomfortable, you know you've got this stretching here, so you're slightly weakened already because those tummy muscles are already stretched. I would just say just rein in on the intensity of your twists and focus instead on just the mobility aspect of them. So just to feel that you get a little bit of comfort or just easing off of the discomfort through your tummy. When it comes to work where you're going to be face down on the floor, again, you might feel that the tummy on the floor is going to be a bit uncomfortable. A little trick is to take, whether it's your cushion or your towel, pop it underneath, not your tummy, but your hips. So it just comes underneath your pelvis. What that's going to do, it opens up the lower back a little bit, similarly to when we pop that cushion under your bottom when you were lying down. It takes the tummy off the floor a little here as well, so you're not pressing down so hard. And it just opens up the lower back. Again, you might need to drop the intensity of some of these exercises, but just it gives you a comfortable starting point. So there we have it, 5 easy ways to adapt your Pilates just to make it more comfortable during those times when your tummy is swollen or sore. Please do drop me a message if you are struggling or you've got any questions about what I've suggested. I am always happy to answer questions, and I'd love to hear from you if you found this helpful.